My name is Cecilia and I'm doing a complete adult health assessment. This is the last assessment for this class today. Okay, I have my equipment here. This is my hammer. I have my tongue blades. I have a cutting. I have the sharp and the dull touch. I have alcohol preps, gloves to massage the mouth if I need to by manually. I have a tuning fork. I have a paper for eye vision. I have my ophthalmoscope for the eye inspection. I have a thermometer for temperature. I have a blood pressure cuff. I have a flashlight. And I have an otoscope. I have some water to test for her thyroid. And for the sake of not making the video too long, we already checked her vital signs. We already checked her height, her weight, and her waist circumference. So we just go do the actual body assessment right now. So first I'll begin by inspecting her. General inspection, look at her color. Her color is consistent with her race. Then I'll begin with the head and face inspection. I'll look at her head, make sure it's symmetrical, equal on both sides, and I'll look at her face, look at her facial expression, make sure it's appropriate to her behavior. And then I will check her sinus for tenderness. Does it hurt? No. Okay. And then I will check her temporal artery and the temporal mandibular artery. So, her temporal artery right here, temporal mandibular. Open and close the mouth. Very good. And then next we will check her eyes. We'll check her eyes for symmetry. Make sure eyes are equal on both sides. Make sure our eyebrows are equal, and then we will dim the light and check for her red reflex with an ophthalmoscope, and then we'll check her pupils for response to accommodation and light. So I will inspect her sclera and her conjunctiva. Alright, conjunctiva is pink, her sclera is white, and her cornea is clear. And then I will dim the light and I'll check her red reflex. Go for that light. With an you're capturing me, Fidelis. So we're going to use an ophthalmoscope to check her red reflex. This one. Go. Alright. That was good. Check her reflex, red reflex in her eye vessels. And then next we will must have put a little bit on. We will check her, we will inspect her ears. We'll inspect her ears for symmetry. Look at the ear condition, make sure there are no lesions. We check the meatus and we move the auricle and use an otoscope to inspect her tympanic membrane, which will be pale gray in color. So check her ears for symmetry. They're symmetrical. Move the auricle. Check the tragus. And then I will change this. I remove the eyepiece. And now put the piece for the otoscope. I am going to check her tympanic membrane. It should be gray in color. All right. And then I will do a hearing test. I will do the whisper test to check her hearing. Oh, say one, 2, 3. Okay, good. She has some good hearing right there. And then we'll move on to inspecting her nose. We'll inspect her nose, make sure her nose is in midline, and we'll check her for patency. And then we'll use the speculum to check her septum and the turbinates. Okay, her nose is in midline. I'll check for patency. I'll close one nostril and breathe in and out of the other. I'll check the other nostril, exhale to exhale. And then I will inspect her turbinates with a nasal spectrum. Look inside your nose. Okay, and then that was her next. Next, we will inspect her mouth. I'll use a pen light to inspect her mouth. We're done with that. Or the pen light. Okay, I'll use the pen light to inspect her mouth. I'll look at her. Okay, use a pen light to inspect her mouth, her buccal mucosa, her teeth, her gums, and we'll grade her tonsils if they are present. And then we'll check her uvula for movement and ask the person to say ah and stick their tongue out, and I'll check for gag reflex. So I'm going to use a pen light to inspect her mouth. Okay. I'll check her teeth and her gums. And I'll use the tongue blade to check her uvula movement. Say ah. Okay, stick your tongue out for me. Alright. Good. And then next I will inspect her neck for symmetry, and I'll check for lumps and palpate her trachea and make her do a range of motion to test her muscle strength, and then I will check her trachea. Okay. I'll check your trachea first. Make sure it's in midline, it's not deviated to the left or to the right. And then next I will palpate for cervical lungs or cervical nose. Okay. And then I will test your muscle strength. Move your neck from left to right and up and down, side to side. Shrug your shoulders. Okay, good. Then I will step behind you with my stethoscope to check. Yet I'm not going to do nothing. Okay, I'm going to palpate your thyroid glands. I will give you this water to drink and make sure your thyroid moves up and down and back to its original position. Okay. We can do the posterior check where I have to stand behind you and check your thyroid gland. Okay, very good. Next, we go do the posterior chest, posterior chest and lateral. See if you can turn that. Let me see if I can inspect your back. I will inspect a posterior chest configuration, check your thorax cage, and I check for fremitus, tactile fremitus. So I will check for the lung fields and I'll auscultate and palpate. Okay, I'll do the tactile fremitus first. Say 99. 99. 99. Okay, and I'm going to check for symmetry. And I'm going to check the spinous process. Can you bend slightly forward? Okay. And then I'm going to listen to your lung sounds. I'm going to auscultate while I'm back here. In and out. Okay. And I'm going to hit on your back and check for 10 minutes. Tell me if it hurts. Does it hurt? Does it hurt? Okay. Alright. Next, we will move, I'll go in front of you and do the anterior chest. I'll inspect your chest. I'll check your respiration characteristics. I'll palpate for tactile fremitus, and I'll percuss your lung fields. I will acoustate for bell sounds and compare both sides. First, I will inspect, make sure everything's okay, and then I'll check. Okay, and then I will palpate for fremitus. Say 99, 99, and then I will acoustate your breath sounds. Respirations are normal. Okay, I'll check the heart for heart mobile. I'll ask her to lean forward a little bit, and I'll put my stethoscope at the base of the heart and then the apex. Lean forward a little bit. Okay. And then we will move on to checking. I check her heart for murmur. I didn't hear any heart murmur, no brewing. Then I will check her upper extremities, and I'll test her for range of motion on her hands and her wrists and her arms. And I'll palpate her epitrochlear nodes, palpate temperature, capillary refill, and compare her radial and brachial pulse. So see if you can move your wrist, your arms, side, and down. And I'll check your hand for temperature. She is warm. And I'll check her capillary refill. Less than 2-second refill. And I will check her brachial and radial pulse. Check her radial pulse. Brachial. Okay. And then for the female breast exam, I will explain it. I'm not going to ask her to take off her clothes. But when a female comes in for a breast exam, you ask her to undress and put a gown on. Ask her to lie down 30 degrees flat. And then check the breast for symmetry. And then ask her to raise her if you're checking the right breast, ask her to raise the right hand above her head, and you palpate the breast for lumps and palpate the nipple for checking for discharge, and you inspect the nipple for any dimpling if she has any dimple in her nipple. And then you support her arm and check for nodes under her arm. For example, I'll hold her arm and I'll check for lymph nodes under her arm. Okay, and then if I finish with the breast exam, I'm going to educate her on how to do a monthly self breast exam, which is good to be done in the shower because at that time everything is loose and your body is loosened up, and the soap will make it slippery and easy to detect any node. After the breast exam, I will check her neck vessels to inspect her jugular venous pulse and yeah, her jugular venous pulse. I will use the big light to check her venous pressure if needed. But I'm going to check her jugular venous pulse on her neck on both sides. I'll ask her to move her face to one side, checking for pulsation. Checking for pulsation. Okay. Then we will move on to, okay, we'll move on to the heart and now inspect the pericardium and palpate for apical pulse and note the location. Palpate the pericardium for any abnormal trio of, and then auscultate the diaphragm with a stethoscope and auscultate the heart sounds, and then you will auscultate the apex of the heart while she's facing on the left side, and I'll be on her right side. So I will inspect the pericardium and I will auscultate for breath sounds. Okay. All right. Breath sounds are normal. No wheezing. Okay. Roll over to the side. And now check on the effects of her problem. Okay. Next, we will move on to her abdomen. I will inspect her abdomen. I will inspect the contour, the skin characteristics, look at her umbilicus, and check for pulsation. And we'll percuss all 4 quadrants of her abdomen. And then I will try to locate the spleen. Okay. Look, listen, and feel. Her abdomen is flat, non-distended, and I will listen to her bowel sounds. Upper right and left, and then down one. Okay. Okay, she got very active bowel sounds. And next we will palpate all quadrants of her abdomen. And now I will palpate her inguinal area. Does it hurt? We can do some deep palpation to see if we can, kidney on the right side can be easily felt. But I didn't palpate the spleen. The spleen is not palpable. Okay, then next we will do, I'll check on her lower extremities. I will be looking for hair distribution in her lower extremities. I will palpate for temperature. I will separate her toes to inspect in between, and I'll test the muscle strength on her knees and hips and her feet. So we will check the dorsal pulse, popliteal pulse. Alright. Her lower extremities are equal. her hair distribution is equal. I will check for pulpitecals, back up and tibia, dorsalis pars, and I'll check the strength of her lower extremity. See if she can throw her leg up, knee to hip. Move your feet, wiggle your toes, and I'm going to take off her socks to inspect in between her toes. Make sure you don't have any wound. Okay, inspect in between her toes. Alright. And now check the temperature of her lower extremities with the back of my hands. Skin is dry and warm to touch. Next, we will do not the muscle strength. We did the strength. She moved her legs up and down. Then next I will help her sit up, and I'll watch, make sure she doesn't have any difficulty sitting up, right? And then we will do some neuro checks. We will do the light touch, the sharp touch, the dull touch, and with the cutting and the tongue blade. This is a tongue blade, this is a sharp side. And this is the cutting for the light touch. And then we will do the stereognosis, where she's going to tell me what kind of object I'm giving her to hold, and then we will do the finger nose test. Alright, I have this object. You go close your eyes. When I touch you, you tell me if it's sharp or dull. Sharp. Dull. Okay, I have a cotton in my hand. It's going to be a light touch. Let me know when you feel it. Okay, now I'm going to give you an object, and you touch it and tell me if you can make out what object that is.
This is a pen light.
Okay, that's a pen light, correct. Okay, and then I'm going to touch your finger to, we're going to do the finger to nose test. Touch my finger. Touch your nose. Okay, and then we go do the alternating movement. See if you can faster. Okay, next we'll move to the reflexes. So we go check the deep tendon reflexes, bicep, tricep, and the brachial radius with the hammer. We do the out test. We do the vibration test on her toe. Tell me when you feel it.
I feel
Okay. Then next we will move to using the hammer to do the deep tendon reflexes. Do the bicep, tricep. Okay. And now do the pectoral and the Achilles from the beginning. And the Achilles. Okay. We're almost there, Fidelis. Okay. Next, we will we'll do the Babinski test. Make sure she's not positive for Babinski. Okay. And then I will inspect her lower extremities for varicose veins. I had looked at this earlier. She doesn't have any varicose veins. She's very young. She has not done nursing. She just about to go start working, so She has not stood on her legs for a long time, so no varicose veins for now. Thank you, girl. Now, we will check her musculoskeletal. I want you to walk straight and then turn around and come back to me. And then do the alternate walk for your heel and your toes, heel and toes. And then see if you can walk on your toes. And turn around and come back on your heels. See if you can walk on your heels. No problems with it. And then we will do the Romberg test to see for balance. Close your eyes and stand straight. I want to see if you can, if you're on balance, if you can shake and move on one side. Okay, open your eye. Okay, now we will do, I will ask you to stand on one leg and hold your side to support yourself on something and hold, see if you can hold, touch your toes with one leg. And then you turn around and now check your hips for range of motion. I will stabilize you and you move from side to side, front and back. Okay. No problems with that. She's able to do her range of motions. Her muscles are strong. So that is it. The spinal process. Oh, bend down and touch your toes so I watch your spinal cord. Okay. No deviation. She's all right. Thank you very much. That is the end of my assessment.